Hello, everyone. You're welcome to the Women Lighthouse podcast. This is a community for purpose driven women who desire to live their dreams and aspirations. Our mission is to inspire you to live your dreams one day at a time while serving as a beacon of hope and guidance. We will be addressing various issues related to womanhood. Join me as we explore our journey of life together. I am your host, Uime Hamilton. Hello, ladies. You're welcome to today's episode of the Women Lighthouse podcast. It's great to have you on the show today. Today, we're going to be talking about reasons why you should screen for cervical cancer. And in today's episode, it's basically about creating awareness on the importance of knowing your cervical cancer status. And as I begin this episode, I just want to lay a background. I practice as a medical doctor, and one of the things I do in my practice is screen women for cervical cancer. So we need to understand that in Nigeria, cervical cancer is the second most common cancer amongst women after breast cancer. Also, it's the second leading cause of cancer-related deaths in women. Cervical cancer is commonly occurring in women who are sexually active. In other words, as long as you are sexually active as a woman, you are at risk of developing cervical cancer. And how does cervical cancer come about? It's as a result of an infection with a virus called the human papilloma virus, and this virus is transmitted during sexual intercourse. So we need to understand that as women, knowing your cervical cancer status empowers you to lead a healthy life. So before we go into why you should screen for cervical cancer, we need to understand that basically when it comes to cervical cancer screening, women from age 25 to 65 years should screen every 3 years. And there are different types of cervical cancer screening methods. First is by doing a blood test where you checked if you have an infection with the human papilloma virus, which is called an HPV virus for short. So when the blood test is done, it identifies whether you are HPV positive or HPV negative. If you are HPV positive, then you're treated for it. Then if you're HPV negative, you repeat the screening again after 3 years. Then if you don't want to do the blood test, there's what's commonly called the pap smear. That's the one many of us know about. In the pap smear, basically, we open up your cervix. And for those who may not know where the cervix is the lower part of your womb that has to open up completely for the baby to come out during vaginal delivery. So when it comes to the pap smear, basically we open up your private area and we take a swab from your cervix region and we check and see if there are any abnormal cervical cells. Also, another method for screening is through visual inspection. Visual inspection, we open up your cervix and we apply a chemical to the cervix and see if there will be any changes in the cervical cells there. If there are any abnormal changes, then we'll say that the screening is positive. But if the cervix still remains intact the way it was before you apply the chemical, then you would say that the screening is negative. What's the difference between these three screening methods? Basically, for the pap smear, the result doesn't come out in time, but for the visual inspection, within a short period of time, about 60 seconds, the result is out. And also for the HPV test, the result also doesn't come out in time. So it depends on what is available wherever you went go to get tested. But all these methods are readily available, and in the order of the cost, the HPV test is more expensive, while followed by the pap smear, which is cheaper, and followed by the visual inspection, which is the cheapest. So now let's go on to, before we examine why women should screen for cervical cancer, there are so many reasons why women are skeptical about screening for cervical cancer. For women who are skeptical about screening for cervical cancer, during the course of my practice, when you interact with these women, you find out that some of them are not aware of what cervical cancer is. And because of their lack of awareness, they do not want to screen. Normally, in our environments where we find ourselves in Nigeria or in the low income countries, they don't feel the need to be tested for something that they do not have symptoms for. And especially when you have to pay for it, they would ask you, why should I pay for a test when I am not feeling any symptoms? So the health seeking behavior normally of people in developing countries is that they don't seek for health care except they find the need to. So when they do not even know what cervical cancer is all about, and when they hear the word cancer, that fear that cancer is a deadly thing. Oh, it's not my portion. I don't have cancer. I'm not having symptoms. I'm fine. Everything is okay. And the moment they know that you are going to have to take a sample from their private area, that alone is another reason why they do not want to screen for it. For some people, it's the financial constraints, like I've mentioned earlier. Why should I screen? I have so many things I need to do with money, so many pressing things. Why should I spend that money to go and screen when everything with me is okay? Then the fear and the anxiety also, that if I end up screening, what if the result is not normal? What happens? Is it not better that what I do not know doesn't hurt me than knowing about something and I become a bit afraid on what the outcome of the results will be? So that fear and anxiety associated with whether the results will be normal or abnormal is also another reason why women do not like to screen for cervical cancer. Another common reason we encounter in medical practice is due to cultural and religious beliefs. Like I said earlier, they would say, oh, God forbid, it's not my portion. Because of that, they don't see the need to screen. That's for religious belief. Then there are some cultures that demand that the women, like for the northern cultures in Nigeria, demands that the permission of the husband is needed before the women can go for such procedures or such screening. So the husband has to give the consent. So imagine if the husband doesn't even know what cervical cancer is all about and why it's important to screen. So he won't give his consent, and in that way, the woman would also not screen. Also, negative experiences from other gynecological procedures. For instance, maybe during child delivery, the woman had a very, very traumatic experience during the course of the delivery, maybe because the labor was prolonged, or she encountered a tear, or she's just uncomfortable around that area. Even for women that have CS and have not had vaginal delivery, because their pelvic area is a bit tight, that experience of fear that, oh, as I'm going through this procedure, it may actually be discomforting. So that negative experience also is another reason why women do not like to screen. And lastly, like I've earlier mentioned, when they have different priorities, they have priorities of juggling work. "Oh, I'm so busy, I will not be able to go for the screening," or family responsibilities or other commitments. So they prioritize those ones as more pressing needs compared to that of the cervical cancer screening. So these are some reasons why women do not like to screen for cervical cancer. And now Why I am speaking with you today is to convince you on why you need to screen. The first thing you need to know is that cervical cancer is preventable. So, when an individual is infected with the HPV virus during sexual intercourse, the virus can stay in the body and in the bloodstream for a prolonged period of time, for up to 10 years, before it can even develop into being cancerous. One thing we also need to know is that this HPV virus doesn't only lead to cervical cancer, it also leads to other illnesses that have to do with the cervix. So it's not just cancer. So, in other words, you can be infected with the virus, you won't have any symptoms, everything will be fine on its own. After the virus runs its course, everything just resolves. So, in other words, if each and every one of us as women get tested for HPV, there is a chance that we would be infected with the virus. But because we do not have the symptoms, we do not have the disease. A disease is when the causative organism leads to an illness. So that's even why we want to check for cervical cancer changes, because once the HPV virus has stayed in the body for a prolonged period of time, in some cases, if the immunity is low, it can cause changes in the cervix, and over time that changes in the cervix, if not treated, can now lead to cervical cancer. So it's not like once you get infected with the virus immediately you are cancerous. No, it takes a prolonged period of time. So imagine if you were screening regularly, which is supposed to be every 3 years, once your immunity is normal. But for people with low immunity, such as people that have HIV, people that have diabetes, or other illnesses that reduce the immunity, they are advised to screen every 2 years. So imagine if you screen every 3 years or every 2 years if it applies to you. If there is already an infection with the HPV virus, it's easy for you to pick out whenever a cervical change occurs, and it's easy for you to treat. That leads me to the second reason: it is treatable. Once there is early detection of the cervical changes, then you can, before it leads to cancer, it can be treated. And the treatment at early stage is cost effective. It's when it progresses to late stages of cancer that it now becomes very expensive to treat. So it's preventable and it's treatable. Also, another reason why you need to screen for cervical cancer is because it allows for close monitoring. Remember, the cervix is an area that is not visible to you as a human with your human eye. It only takes someone else to open up and visualize if there are changes there. So, because it's something that you cannot easily identify and pick out, when you screen regularly, it helps to improve monitoring so that when there are abnormal results, it can be intervened promptly with treatments. The fourth reason why you need to screen for cervical cancer is because it reduces the death rate amongst women. Like I earlier mentioned in the introduction, women that die as a result of cancer, most of them die due to cervical cancer after breast cancer. So when you screen regularly, as you should, and the illness or the cervical change is identified ahead of time, then it's easy for you to intervene and reduce the risk of that woman dying. So, for every woman working and living, we are all at risk of cervical cancer. Once we screen, the chances of us dying from that cervical cancer is slimmer. Why are we at risk? Because it's transmitted through sexual intercourse, that's the virus. And each and every one of us, as long as we are within the reproductive age, which is the age of 25 to 49, we are at risk of developing cervical cancer. The fifth reason why you need to screen for cervical cancer is because it's a simple and quick procedure. I mentioned the three different types of screening methods available. Each of those screening methods are quick. It's now the rate at which the result comes out that differs. So the average time it takes to do a cervical cancer screening on an average for the three procedures, it's about 2 to 3 minutes. 2 to 3 minutes. So it's a very simple, straightforward, and quick procedure. Yes, there are some side effects that comes with the screening, such as discomfort. And the discomfort is as a result of having to use a speculum to open up to be able to see the cervix properly. So most women find that discomforting, but there are ways to make the experience less discomforting by using a gel to ensure that by the time you are putting in the speculum, the friction the woman will experience is lesser. Also, another reason why you need to screen for cervical cancer is because it helps you know your status. If you are a woman listening to me and you do not know your cervical cancer status, today is the right time for you to know your status. When you know your status, you know whether you are at a high risk of developing cervical cancer or you're at a low risk. Once you know if your cervical cancer screening is negative, it means you are at a low risk. But if it is positive, but there are just mild cervical changes that are observed, it means that you are at a moderate risk. And at that stage, it can be treated. But if the cervical cancer screening is done and it's already observed that the cervical changes are so extensive and is suspicious of cancer, it now means you are at a high risk. So it's better for you to know your status so that you can classify what your risk level is. If you're at a low risk, is meaning the screening is negative, then it means you screen every 3 years to know your status. If you're at a moderate risk, that means the screening was positive but is not suspicious of cancer, the changes can be treated, then it means you need to screen after it's treated, you screen after 6 months, then you now begin to screen annually to be sure that it has not reoccurred. Then if you're at a high risk, at that point in time, you go on, there is no treatment for the screening at that point in time. Rather, you'll be referred to see a gynecologist, which is a doctor that specializes in female reproductive organs, to now give you a treatment and really check if what you have is cervical cancer and treat accordingly. The seventh reason why you need to screen for cervical cancer is because when you screen for cervical cancer, it helps you know what is going on in your cervix. It helps with diagnosing other cervical cancer, other cervical conditions. Like I remember a time when I did a screening for one of my clients, and by the time I opened and visualized the cervix, I saw a very massive growth in the cervix. Then when I began to ask her questions, she said, yeah, she noticed that she was at some point she was having some form of discharge. The doctor didn't examine her, like open up to see what was going on, just said she was having infection and they gave her some medications and treated it. Then she also noticed that when she has intercourse with her partner, sometimes she has some small spots, that's small bleeding, but she just felt it wasn't anything major since they had told her it was an infection. But the her showing up for that screening and me screening her helped in identifying that she had another cervical condition. So when you are open to screening for cervical cancer, even if the screening turns out negative, sometimes we discover women are having discharges. At that point in time, we take a swab and we get it tested for whatever infection they are having. So you see the advantage in doing your cervical cancer screening. It helps you to identify other cervical conditions that may be present. And the last reason why you should screen is that it helps to improve your quality of life. When I say quality of life, do you want to be living and the money you would have been spending on something else, you are using it to handle expensive treatments from complications that have arisen due to cervical cancer? Also, when I talk about quality of life, do you want to live as one who has been diagnosed of cervical cancer and you have to be dependent on people? You don't have your independence as you're aging because you're having regular hospital visits, you're in and out of the hospital, you're dependent on people. All those things reduces your quality of life. But once you screen and you know your status and treatment, if it's positive, can be started early enough, it helps to improve your quality of life. One thing we need to know is that a lot of people who have been diagnosed with cervical cancer at an early stage and they were treated and they were cancer free. Many of the people that die from cervical cancer die because the diagnosis was discovered late and by then complications had set in and the prognosis of getting better was really low. I'm going to be sharing a testimonial of one of my clients who wants to share her experience about her cervical cancer screening.
Good morning to you all. Good morning. Whoever is listening to this, please, is a piece of advice, and I want you, especially women, to listen very carefully and please help me share. I have an experience that I want to share. My experience is about cervical cancer. You see, a lot of women I don't know, we are so scared that we don't like undergoing the test. But one thing I will let you know, doing this test is very, very good and important. Why I'm saying this is because I'm using my own as an experience to encourage and enlighten you people. I've been doing this cervical test pap smear for like 12 years now, since 2012. I did the first, the second, and I was about to do the third when they found out that there is a growth inside my womb. If I had not done that test, how will I have known? This is something I've been experiencing, sporting, irregular sporting, and even after intercourse. I've consulted a doctor without examination, maybe due to my explanation. He said it was a hormonal imbalance. Even after taking hormonal imbalance drugs, it did not stop until when I went for palm semen. Now they've detected it and there is cure and treatment. So I am advising every woman, if you have not done it, if you have not been doing it, please and please try and do it to save a life. Please, early detection is very, very important and good for us. Thank you very much.
So it's important for us to know that screening for cervical cancer is a priority for every woman. Who should screen for cervical cancer? Once you are between the age of 25 to 65, you should be screened every 3 years. For women who are below the age of 25, 21 years, between 21 years and 24 years, and are already sexually active, it's also advisable that they should get screened. For women that are above 65 years and were screened, but during the course of their screening, there was an abnormal result, or they were not screened regularly, that's every 3 years, those women also should still be screened for cervical cancer. Then for women who have had surgeries where their womb was removed, but partially, that the upper part of the womb was removed, but the cervix was left behind, those women too should still be screened because their cervix is still there. And for women who have also been vaccinated with the HPV vaccine, we will talk about that shortly, they should still be screened. Then who shouldn't be screened? Once you are below 21 years, the risk of developing cervical cancer at this stage is very low. So there's no need to go on screening, even if you are sexually active. And once you are above 65 years, you had your 3 yearly screening and all the results in the past 10 years was normal, then there's no need to go on to screen after your 65 years. Then if you've had like a surgery where the womb was removed completely, commonly in fibroid surgeries where they take out the womb and the cervix together, there is no point screening because you don't have a cervix. Then if you have been screened before and the result was abnormal, you were treated, and over a period of repeated testing, everything was fine and it wasn't suspicious of cancer. Once you clock 65, there's no need to screen again. As we draw this episode to a close, I just want to talk about the HPV vaccine. For children aged 9 to 14 years, it is essential for them to get the HPV vaccine. What does this HPV vaccine do? The HPV vaccine helps to treat infections with HPV. So if you have a child who is 9 years old, for instance, and is not sexually active and has been vaccinated, once that child becomes sexually active, the child would already have developed some level of immunity so that even once the child is infected with the HPV, effect of the virus on the child's body is minimal compared to someone who was never vaccinated. That's how immunization works. So for children aged 9 to 14 years, it is mandatory that they should be vaccinated for HPV. Also, for those who are aged 15 years to 26 years, it's also important that they should be vaccinated with HPV. So if your child has gone past the 9 to 14-year age limit, that doesn't mean they can't be vaccinated. They can still be vaccinated. The only difference is for children aged 9 to 14 years, they will get 2 doses of the vaccine, a first dose and a second dose with 6 months apart. So in other words, you take the first dose, after 6 months, you take the second dose. But if you are more than 14 years of age and you want to take the vaccine, you will take 3 doses 6 months apart. The first dose, after 6 months, the second dose, after 6 months, the third dose. Also, adults can be vaccinated with the HPV vaccine. The only thing we need to note is that this HPV vaccine will not treat an existing HPV infection. So if you're an adult and you want to get the vaccine, the first thing is you will be tested. If you are HPV negative, you will be vaccinated. But if you are HPV positive, you won't be vaccinated because even if you are vaccinated, it's not going to provide that protection because you've already been infected. So it's also important to note that for adults, even if you have been vaccinated, you should still be screened because you are sexually active and it's important for you to continually know your status for cervical cancer. So I hope with these few things I have shared with you, you are convinced on why you need to get tested for cervical cancer. You need to do so because your quality of life is important. Like the common saying goes, prevention is better than cure. The few minutes you would take and the few amounts of money you would spend to know your status every 3 years till you clock 65 if the results are normal would be far cheaper than if you had to spend so much money to have to treat a complicated case of cervical cancer. Thank you for listening to today's episode of the Women Lighthouse podcast. I hope you were inspired to keep taking steps towards living out your dreams. If you enjoyed this episode, we encourage you to share it with other women and leave us a review on our social media platform, which is in the description box. Also, feel free to subscribe to our channel to get notified of new episodes. Till I come your way on our next episode, keep living, keep dreaming. Bye for now.